Casey Marie Ecker quit her 9-to-5 during the pandemic. She says her symptoms made it impossible to manage. Now she's picking up odd shifts here and there, like at this theater.
I was just running behind on all my tasks and I didn't have any focus or drive.
Even though she's never been formally diagnosed with ADHD, a doctor at a primary care clinic gave her prescriptions for different psycho-stimulants so she can manage those symptoms.
It's like helpful to be on this medication, but at the same time, it's like playing Russian roulette.
Her story, part of a growing trend. The number of ADHD meds being prescribed in Canada has jumped by 56% between 2019 and 2023. Rates among young women the highest, from 4.6% of those aged 18 to 24 to close to 8.6%. Numbers from the US suggest 1 in 4 adults suspect they have undiagnosed ADHD.
If you put 5 fingers down, you have ADHD.
One reason for the hike, social media videos like this, says this psychologist who practices in a private clinic specializing in ADHD.
People can get very attached to this idea of ADHD. They do their preliminary research. They've looked it up on the internet, social media. They've done some online tests. They feel like they are pretty convinced it's in the picture.
Bailey says a diagnosis can be validating. It can also allow for treatment and accommodations. But in the private system, a diagnosis is costly. At this clinic, testing starts at $2,300.
The actual diagnosis of ADHD is a complicated clinical assessment.
For those who can't afford private costs, the public system has drawbacks, longer wait times for a comprehensive assessment.
In a strange way, I think a lot of people identify with the diagnosis of ADHD, but a lot of people who have adult ADHD are probably struggling accessing getting a formal diagnosis of ADHD. So there's a bit of a mismatch.
Gruch says in the public system, family doctors will need training and support in diagnosing and treating adult ADHD to meet the demand from patients like Ecker. Jennifer Yoon, CBC News, Montreal.